bell.
Yeah.
Okay, so there's like three things that sort of ring a bell. The first one is occupational exposure. So were they in a job, or were their parents in a job that then they brought those chemicals home, or maybe the job was in the garage, for example, that would be considered a high dose exposure. So an occupational exposure, a high dose exposure, is more likely to contribute to a symptom or a disease than a low dose exposure. Then in the history, I'm looking for low dose exposures. So is there enough of a low dose exposure at a critical window of development that may have triggered this disease condition?
So adolescence
During
utero.
puberty, in utero, those during lactation, breastfeeding, are considered your critical windows of exposure. And then sometimes with low dose kind of everyday exposures, because like you said, we're exposed every day to chemicals, it has to do with genetics. Is there genetic makeup such that even a cumulative over time low dose exposure, because remember we are exposed usually to more than one chemical in a day, more than one chemical in a day, is the patient's genetic makeup such that they just can't process or metabolize those as well as somebody who didn't develop that symptom or that condition? And that's where some genetic testing can be useful to help determine if that is the link that the physician needs to make.
So you're